Great. Welcome, everybody. My name is Carolyn Dubé. I'm the Executive Director of Fertility Matters Canada, and it's Canadian Infertility Awareness Week, April 19th to the 25th. We are celebrating assisted reproductive technology and family building across Canada, and I'm thrilled today to be bringing you Dr. Munaf from Anova Fertility Center in Toronto. They are a partner clinic with Fertility Matters and support us, which means they're supporting you, the Canadian fertility patient. So I'm going to let him take over. I'm going to stay on screen, and we're going to have a conversation about male infertility. Dr. Munaf?
Hi, thank you very much. My name is Abdul Munaf Sultan Ahmad. People are calling me in my middle name. It's called Munaf. So today the subject is a male infertility. Overall, fertility is it's a big, vast subject. So if you are talking about fertility, it's involved both male and female. So I'm just addressing only bringing the topic as a male infertility. Male, approximately 1 in 6 couples in the world has the fertility issue. See, out of 30% is a male factors. So let's tell you about how sperm process in the testes. It takes the 72 days to process everything from spermatogenesis, spermatid, then becomes sperm. So in duration of this time, if you expose to any kind of your lifestyle changing, any kind of chemicals, any kind of antibiotic, any kind of steroid, anything, this can affect for your sperm count. So how we'll find the abnormal sperm, normal sperm? You have to do this semen analysis. How we will do this semen analysis? Semen analysis mainly focused on the sperm count, motility, morphology. Additions to this, we used to start doing the DNA fragmentation test and blood test. So this is the first beginning of the screening. So suppose if you find that you are planning for the having the child past 1 year, unprotected intercourse with partners or husband, wife, if your partner is not conceiving, that means you got fertility issue, infertility. Either it is a male or female. Since I'm just talking about the male, I'll take it as a male. What you have to do for that? You will come to the center and first see the physician, or she will explain you and she will give the request for this semen analysis. What we will do in the semen analysis? When you come to the center, we will give you the container to produce the sperm, and we will take 1 drop of the sperm and we check your motility. Then at Anova, we have got state of art, we have got computerized system, which is a CASA, and we have got multiple other systems to check, like a sperm morphometric analysis, evaluate your sperms to it's a healthy or not healthy, or you need further tests to do to go for the proper procedure. Let's say you've got normal count, normal morphology, do you well and go. Sometimes you can do the timely intercourse, or you can go for small procedure. It's called IUI. It's called intrauterine insemination. So that's a very simple procedure. If not, then you have to go for the IVF microinjection. It's called intracytoplasmic sperm injection. It takes 1 sperm and injecting directly to the cytoplasm, then it's get fertilized. So, and IVF. IVF is naturally, we inseminate the sperm into the egg and it will fertilize itself. Some reason it may not be fertilized. That's the reason you need to screen the sperm very well to know not to come as a surprise next day. So these days, no one does the 100% IVF because it's a risky. Suppose patient has like a few eggs, better to do the microinjections. If you have got 10 to 15 eggs, then we will do the 50-50, like 50 IVF, 50 EC, so that you must know that whether it's a normally how it's get fertilized, or ICSI. So ICSI, normally my center has we got 90-95% fertilization, is fantastic. So that's the reason you need to make sure that when you come to the IVF center, that first thing that men should have to have the sperm. So if you don't have any sperm, then you have got a problem. So what is the chances of don't have sperm? There's many chances. These days can be many cause can be possible to not to have the sperm, like injuries, illness, like health problems, lifestyle.
What type of health, Dr. Munaf? Sorry, I don't mean to interrupt, but I was just wondering what type of health condition may cause someone to have low or no sperm count?
Yeah, so some of them has a health condition like a varicocele infection and ejaculative issues and sperm antibodies and undescended testicles and hormone imbalance and defect of the tubules and transport the sperm. It's called obstructive and obstructive sperm and non-obstructive azoospermia. This is the one of the issues is facing everybody, and chromosome defect and problem of sexual intercourse. These days is a lot of couples are undergoing this kind of issues, but they're not discussing. If you guys have anybody has the issue of the normal intercourse, problem in intercourse, please go and see your doctor as early as possible. Iliac disease, certain medications, period surgery, and some kind of surgeries like they do the vasectomy reversal that makes the low sperm count, there is no sperm count. That's all small things, it's a very fixable.
What about lifestyle factors? Do lifestyle factors affect?
Yes, it is a lifestyle factors very affect, because the in lifestyle, some people, they take a lot of stress. Like people are sitting down and doing a lot of work with using the laptop on the lap. You know what will happen? This can increase the testicle temperatures more. What is the testicle temperature? Testicle temperature is a less than 1 degree less than of the body temperature. So if it's a shoots up your temperature, your testicle temperature, then it affect to your sperm count and its morphology. Maybe it is for the DNA fragmentation. So people are sitting one place, then can cause your overweight, obesity, and diabetes. Diabetes is a major issue. Some studies shows the diabetic men don't have ability to fertilize the eggs. And that's very important to know. So over the age of men, above 40 years, the study shows some of them, their sperm count is decreasing. And fertilization is poor. But it's not necessary. Depends on some of the men, 40, 50, they look very healthy. And they have got good sperm count. I've seen one of the men, 80 years old, he got 80 million sperm. Yeah.
Wow.
It depends on the region. Mediterranean diet is different. It's one of the good diet. It's a good to have the good lifestyle, that kind of diet. And some of them has a worse diet. So people are not taking a lot of stress, staying back home, and they're not walking, not doing the exercise. That may affect the lot of infertility. That affect the sperm count too.
You know, I hate to keep interrupting. I do have something else that just popped into my mind, because I do see this sometimes in our support groups. Does the type of clothing, tighter, like if someone's, say a cyclist and is wearing a lot of spandex pants because they're biking a lot, or even in the gym biking, or, tighter underwear. I see that sometimes as questions being asked. So I was curious to know if there was any validity to that.
Yes, because having the tight, any kind of wear, that affects the testicle temperature. So as much as loosen your outwear. That's the reason these days is people are designing the new designs for the sportswear. It's a loosen. Some of them, they wear the short, very short. So you got like airs are blowing everywhere. So when you're doing biking, and this is very helpful to your outfit also. So for the especially men, you know, some people are there working in the chemical factories. They induced some of the chemicals, some of the like a strong, even the strong perfumes can affect for the sperm count. So, you know, in an embryology lab, you don't have to use any kind of perfumes even. So normally it is not like that. I'm not saying that don't use the perfume. You can use the perfumes, right? You know, but that can. So there's some study shows, but it is not like a significant. And the emotional stress, depression, weight, this will all affect to the sperm very much. And chromosome abnormalities, like there is many factors of, like Y deletions. Y deletions is one of the common factors. Like, you know, people they're missing the Y chromosomes. So in men, normally this kind of abnormality, you can't see any physical appearance. They looks normal, they looks healthy, but there is no symptoms, nothing. But this kind of patients, I'm not saying that they will not get pregnant. They will get pregnant, but later they miscarriage. So that's the reason the lifestyle is very important. That lifestyle, anything you changes, if you're taking any kind of medications in 72 days, so during the process of your sperm, that will affect for your sperm count.
Dr. Munaf, sorry, I know I've got a question that came in, and I was just wanted to ask, with the new regulations around, in Canada, especially around marijuana or cannabis, can drug use, especially recreational cannabis or marijuana, can that affect sperm count?
You know, that is a very, at the moment, is a very conflicting data. We have done this study about the using marijuana, smoking, and how its effect for the sperm fertilization. It's coming up. We already finished those. It's accepted in journal. One of the physicians who done the work and myself, we are all gathered those data, and we took some questionnaires from the patients, how many smoke they're using the smokes and all. It's a very good study. It's coming up soon in the journal. I will, if anybody interested, they can contact me. I can send you those papers for you guys. And it does affect marijuana some extent. You know, any smoking is an effect to the fertility. So either marijuana can affect for the egg quality and sperm quality. It's both, because something is you're changing anything. That's changes in your lifestyle. That's major impact on your fertility.
Great, thank you for answering that.
Yeah. Any other questions? Okay.
I do have one that's come in, but I'm happy to have you continue, and we can ask this question in a little bit.
And okay, when patients came to the clinic, when we start screening the semen analysis, we do the motility. Motility mainly shows the movement of the sperm. Those sperms, we categorize them P1, P2, P3. That means it's a different kind of movement. So it should be straight movement is a very good, because that will help to the sperm getting into the oocyte. See, there is a new study shows all the sperms has millions and millions sperms. It doesn't mean that every sperms can ability to fertilize the eggs. There is a few of them. That's the reason these days we do a lot of screening tests, like a DNA fragmentation test. So we want to know that what is the cutoff range of the DNA fragmentation. So some men are these days most of them are getting the DNA fragmentation is higher. So because of some kind of expose them with some kind of chemicals, or maybe they have got some kind of genetical disease, or maybe their diabetes, we don't know. So still studies is going on. We do the morphometric analysis too, to find out the sperm head and the neck region and the tails. So this screen, you come to know that how good your sperm. So, and addition to that, we do the blood test too, like FSH, LH, testosterone. So this will help you to help us and help you also yourself that how your sperm count is good. And as I said, remember that fertility has two peoples involved, male and female both. If man is a perfect, is all right, doesn't mean that female is some has a problem. Sometimes both of them is normal. Man has a normal sperm, female has a good AMH, everything, she produces good eggs. Still not having any baby is unexplained. That's a different issues.
And Dr. Munaf, how often is unexplained infertility? How often is that something that affects?
It's often. Nowadays, it comes a lot because I can see these days everybody's in very health conscious. They take the good diet. You know, people used to go for keto diet. They used to go for the good gym. They work out per week like twice, thrice. They hire the trainer and they take care of themselves. Good. So there is people are awareness of their lifestyle is a very drastic change. So that's a good thing. So that's the reason these days is unexplained infertility is very common. We don't know. Both of them is maybe sometimes maybe too much dieting, too much exercise, maybe overstressed. Never know. See what I said. I've been working one of the countries, so I saw 80 years man has 80 million sperm, and never know. We need to see maybe they're genetically. So some of the race has influenced their sperm count is very large because their genetic is like that. So maybe, you know, this all effect on our epigenetic. There is a new subject is we talk about epigenetic. That is a contribution towards the epigenetic is a lot for the fertility issues. So in Anova, why Anova is especially different? Because we care the patient as an individually. We take care of them, each of them. See, any patient comes and wants to come and see me, take the appointment, come and see me and talk to me about their results, what they want to do, how far they are. Always they can take my appointment and come and see me. And I just want to explain a little bit about how we separate this sperm. If suppose sperm are very low motility, low count, there is a lot of dead sperms are there. What we will do? We have got different procedures. It's called gradient procedure. Gradient means different density layers are there. We put the sperms on those gradient, we separate them from the dead sperm. So we harvest the good motile sperm to use for our procedure, for IUI, for IVF, for ICSI. So that has a many, we use this kind of procedure, depends on the sperm count. If sperm count is extremely good, then we use the like swim-up method. Is a very, very small method. And suppose patient has a obstructive sperm, like azoospermia, there is no sperm. So we will refer to the urologist that they like obstructive azoospermia and non-obstructive azoospermia. So obstructive azoospermia, some reason is obstruction, and urologist will put the needle on the testes, and in epididymis, they aspirate the sperms out. So 90% we get the sperms. So, and most of the time it is get motile sperm. And study shows those sperms are DNA fragment, free from the DNA fragmentation. That's the reason some of them is a high DNA fragmentation. They recommend go for the testicular aspiration. Because when sperms ejaculating during the ejaculation time, it go through the seminal fluids and some other enzymes, it's a secretion. Those can induce the sperm fragmentation. So some studies they aspirate the sperm from direct from the epididymis. And for obstructive, non-obstructive one has a different reason, like, maybe genetical reason. Those one, even though you can't aspirate any sperm from the epididymis, because some reason, some kind of hormonal, genetically, it's induced the obstruction. So non-obstructive one. So those one, urologists will take the tissues from the testes. Those tissues, we process them, we find the sperm, it's a non-moving, but we have technology to find whether it is a live or dead. Then we can pick up the one sperm to do the ICSI. So this all, actually when it is a obstructive or non-obstructive, we refer them to urologists to evaluate. And most of the time they come to our center to do this kind of procedure. You don't need to go to the biggest hospital to do this procedure. When day of procedure like IVF ICSI, we do it in our center. We got all the facility to do. So because Anova is like a state of art, we take care of all this one, and we got expertise to find even if it's your sperms shows the DNA fragmentation high, we have method to separate the sperms. There's been doing a lot of research on this one. See, having the DNA fragmentation test is high doesn't mean that that there is no research shows that you can pick up the sperm during the ICSI time, that DNA fragmentation free about them. But we have got new technology and we implemented a few things that during the ICSI time we can find the sperm, we find the sperm with the free from the DNA fragmentation test. Still is in studies, but it works so far. We got pregnant also patient. So that's fantastic. That stands Anova always exclusive. And we not only doing treatment, we did a lot of research work also. We known from the academic as well as clinical.
And this DNA fragmentation, does everybody have DNA fragmentation in some or all of their sperm?
Yes, everybody has. See, if you have got like 80 million sperm, around maybe 30% of the sperm has a DNA fragmentation. You never know. You exposed everything, something or something. Let's say about the lifestyle. I just want to talk about something about the lifestyle, which can affect for the this kind of exposure, like industrial chemical, heavy metal exposure, radiation, X-rays, overheating testicles, some of them drug use, alcohol use, and tobacco smoking, and emotional stress, depression, weight gain. So this is all can induce anything. What I said earlier, in 72 days of the time period, if you expose, you will end up with your sperm, it effect on the sperm.
Oh, wow. And then if you were eliminating those, so for people who have potentially come back with low sperm count or maybe low motility, I don't know the answer to this. And then they might not be choosing the best, they might have not the healthiest lifestyle choices. So if someone started to, increase activity a bit, to really take care of their diet and maybe decrease alcohol use or stop smoking, in 72 days, we could start to see an improvement in sperm
Absolutely.
count?
It's happened. It's a many patients. I can see some of our patients, really, we explain them what to do. We got very good supplements here. We give them some of the supplements, and they improved drastically. When they come after 3 months, like 72 days means 3 months. After 3 months, when we repeated semen analysis, we got a lot of improvement. So we start asking them, what did you do? So some of what supplements we give to them, that improved is a lot. And having said that, I just want to tell everybody, this is a time, COVID-19, everybody is a social distancing, staying back home. Staying back home also, it's a big stress. People don't have work, they have a lot of stress. People don't have nothing to do. See, don't overstress, relax. There is many things are there in online. There is over the phone, over the internet. There's many things to do if you want to find. And you can start doing that. You do yoga, and even though you don't have to go to the gym, you can do the workout at home too without gym. And make sure that get enough sleep. People are staying longer hours. They were thinking that there is no job so that they can stay back longer. So your sleeping cycles is disturbed. This can affect for your sperm count too.
Wow.
So yeah, stay away from the overheat. Like some of them has a personal sauna. They stay in the sauna for long hours. That increase your testicle temperature.
So probably hot tubs or hot baths as well?
Hot baths and all. Make sure that it's not long time exposure. So, smoking. Please, if you are smoking a lot, quit the smoking. Do something else. And about marijuana, it's a conflicting some of the data. Some of the data shows some effective, some of them says no effective. We need to have the many data to do, because Canada is regulated very recently. We need to have a lot of data to do this study. Reduce the alcohol consumption. So like up to 2 drinks considered the cutoff, but
2 drinks per day or 2 drinks? Yeah.
2 drinks, yeah. And but reducing the drastically, it's very helpful. And avoid having a lot of caffeine. Caffeine also can induce your motility, effect on the motility. Caffeine is not only having the coffee. Caffeine involved with a lot of places, like ice cream has a caffeine, chips has a caffeine. There's many things has a caffeine. Without knowing, you are taking the lot of caffeine per day. I did one study for the caffeine and fertility. Yeah, caffeine, unknowingly you are having a lot of caffeine per day. So you have to make sure that how much you are taking every caffeine. And eat healthy food, like good vegetable, fruits, do a lot of exercise, rich high protein. And if you guys want to have any kind of consultation for the dietary, Anova has a wellness center, and is a fantastic, we got good expertise. You can come and see us anytime. And in Anova, even though for any embryology and andrology, any questions, if you feel like you have got a lot of questions, you can take my appointment, come and see me. And we have always some kind of education, like IVF 101, that educate you guys before coming to treatment, what you have to educate yourself, what kind of procedure we do. So you got any questions, always don't hesitate, take my appointment, come to the Anova. This is the best place to.
And Anova is doing telemedicine right now too.
Yes,
is that
absolutely,
right?
absolutely, yes. Anytime, if you want to see us after this COVID-19, want to see me personally, to see me, I can explain you with the layman term, everything.
Great. So this broadcast is now national. So for patients who aren't directly in Toronto with access to Anova or to you and your expertise, who would a patient contact if they've got concerns about, should they go to a urologist or should they start with their family physician? What's the starting point for them?
They go to the family physician, take the referral to the any of the doctor or Anova. It's mainly, I think, take referral from the Dr. Dixon is much better. She's the REI, she's the medical director, and she directs to others where to go. Then we refer them to the urologist. We call the urologist file. So because the Anova is with the center, we screen them, everybody. So then we will refer, if they need the urologist, we will refer to the urologist. We got in contact with all the urologists. Okay, so that's a easy to, we can keep very shortcut. Yeah, take the appointment from the Dr. Dixon and come and see her. And even though in the same time, if you want to access me, you can access me too. Also, I'm also same, next to her office is my office is there. You can take my appointment, or you want to, I can jump into her office to explain if you have got any questions.
Right. It's really, it sounds more promising on the male side, you know, that if you don't have the most healthy of lifestyle choices, or if maybe there's some things that you could tweak in your diet.
Yes.
And supplementation. I want to chat with you about that in a second. That, you know, within 72 days, you could actually start to see some higher numbers of sperm or changes in the content of your semen analysis. So that seems really promising for males, where females, lots of times, because their egg storage is not the same. They're born with the eggs that they're going to have for life, and so they don't get the same luxury of that potentially the men do have.
I just want to put addition to this this one. Some of the men who don't have anything sperms, you don't need to worry. There is a donor program. You can choose the donor. Some of the couples, they don't like to have their donor, you know, they have to have their own biological kid. So there is every chances is there. Come to the Anova, screen yourself, and let's find out how far it is. And some of the men that don't mind to having the donor sperm using, that will be very good. And
absolutely,
that's and we have got the Anova has we got like a freezing technique. Even though if you have got the very low count, we can freeze frequently, like 2-3 times before doing the procedures. This will be help them to have their own kid, not having the donors. So we can do that all this one. And there's a new technologies coming up now. It's all that I'm also one of the part of that technology, like research. Like nowadays, people start doing the lyophilizing. You know, you're freezing the sperm with the powder form, like with the ample. Okay, it's coming up new technology. You don't need to be a minus 119 degree centigrade to freeze the sperm. It's coming up technology. You can make the wire, small wire. Yes, even though you can keep it in your temperature. Maybe one point you will come, make the wire, keep it in your shelf. Sperm, right. It's your sperm. And it is, once it's a frozen sperm, it's like 25-30 years. So whenever maybe you want to have kids, reconstitute, and you bring to the IVF center, reconstitute, we can do the ICSI or IUI, anything. So new technology is coming up. Yeah, I'm also part of this technology, and it's many scientists who's working on this one. And,
that's amazing.
Thank you very much.
So we do have a couple of questions that are coming in.
Sure.
For someone with low sperm motility, what are some things that you could recommend?
Like if it's they can take, do the exercise, vitamin C, it shows some of the vitamin D and zinc. And there is some of the urologists who formulated some supplements. It's available in Canada, and it's available in Anova too. So we have got some kind of supplement. It's a combination medicine supplements. It has all of them combined. Like you don't need to take separately. You know, people are thinking that oh, I need vitamin D, vitamin zinc. It is the question of if you are taking orally, how much is absorbed on your body, right? And how kind of nutrition it is, how organic it is. So if you come to the Anova, we have got like a supplement of the men supplement. It's a completely combined drug. It's very good, and we got very good results. So that's the best way to go. And even though sometimes it's available online, make sure that don't go online one. Make sure that even if you're taking online one, make sure that if it's the right recommended dosage for you or it's helpful for you, never know what you have got. Maybe it might be decrease the sperm count. So make sure that it's the Health Canada approved stuff. You use it, recommended one.
And is that a conversation? So in order to know what would be recommended for your own personal health, you should have that conversation with your family physician, urologist, or fertility specialist. They'll be able to recommend what you should be doing, and then you can go out and...
I always recommend come to the see any REI or urologist. That's much better. These two physicians are right physicians to go and talk to them about your fertility. And if it's a male fertility, if it's a female fertility, of course, if it's a REI, need to be speak to them. So,
that's a great recommendation. We have another question here from Facebook. If two brothers both have very low mobility and I think it says mobility and mobility. I think it should say mobility and motility. Both have been tested for Y chromosomal abnormalities.
Yes.
They've seen a urologist and do not have any scar tissue or blockages from previous surgeries. Is there anything else they should be considering to get answers?
They might go for any kind of like chromosomal studies, because there might be Y chromosome deletion maybe. We never know. So maybe they can check for the Y chromosome deletions, because since they don't have obstruction, non-obstructive or obstructive, so they have got sperm. It's coming up, right? There's low count and low motility, and it's both brothers. That means they have got some kind of genetic.
Yeah, and it does say both have been tested for Y chromosome abnormalities.
Yeah, abnormal. That means there's a gene deletions. That's how I just explained you Y deletion. It's called Y deletions. Yes, come and see them. Like, we got few tests to do. Chromosome test, blood test is there, and we'll go from. Sometimes when we speak to the genetic laboratory, they have got specific probes to create those kind of tests to find out what kind of deletions they have got.
Okay, is that more specific testing?
Yeah.
Would a male with consistently 1 to 2% normal morphology need ICSI?
Yes, absolutely. Absolutely. Okay. Yeah. These days, even though it's 1 to 2%, even though 20% morphology people need the ICSI, because it's become so complex. Fertility is become so much complicated. Everything is you feel like you're healthy the day of ICSI, day of IVF, it will not fertilize. So there's many factors are involved. It's a decondensation of the sperms into the egg inside. That's most important to know. See, many of them is thinking, oh, I got healthy sperm, healthy eggs, and when do ICSI, sometimes it will not fertilize. May not be, even if it's not, even though donor sperm using the egg is from women, it will not fertilize. Yeah, so it has many factors there that everything has it's a lot of theory involved, like signaling, a lot of epigenetically factors involved. So this is a everyday. That's the reason embryology is a everyday is a surprise. Each patient is different.
That's great. I guess just to take it to step back, because I don't know that everybody may know this. What's the difference between morphology, mobility, and motility?
Okay. Morphology is a appearance. Like, let's say layman term, girl. I'll take it as a girl. Girl she's a pretty, beautiful. Her eyes is a pretty, right? Lips are pretty. Hairs are pretty. So this is kind of morphology. Like same thing in sperm, if you look at the morphology, at the head, is a cap, and the acrosome, and the neck region. Neck region has all the RNAs. So those region. Tail is only for the swimming the sperm. Tail doesn't come to any kind of role for the fertilization. Okay, until the neck region, head to neck region is the main piece for the fertilization. Sperm tail is the only to swim, but still some of them they consider as a coil tail. Some of them has a coil tail. There's a reason why it's the coiling tail. So when you're looking, this is called morphology. Morphology comes with the acrosome cap. Is as a morphology look like is a bent head. Neck is a pyriform. Cytoplasmic droplet. Cytoplasmic droplet. Some of them you can see the neck has so much is swollen. This is all abnormal.
Okay.
So motility has a different kind of motility. Some of them, have you seen limping leg man? How he limps.
So it's how they're moving.
Yes. Sperm will move same way. It's like limping leg. That's not a good motility. Some of them, they go straight, they run like a marathon. That's a good sperm. Yes. Having said that, some of the good moving sperm don't have a head.
Right.
So they have some defect. So some of them has no acrosome cap. So that's comes with the motility. We make the motility what kind of moving. Like, it goes fast movement, it goes zigzag method, it's go one-sided. So that's motility. Which is another one is a count. Count is always you need to have the decent count. Minimum count is 30 million to the 80 million, 90 million. And morphology, 30% is normal. We have got all of them be done in the computerized analyzer. So we do backup with the manually too. So if it's like a very, very low count, we check in the manual as well as computerized. We have further down, we check them in morphometric analysis. Morphometric analysis, it measures every kind of way, the sperm head, neck region, everything, to know we have got cutoff value. These kind of sperms can come to this kind of criteria. So this is how we categorize.
Okay. And it's crazy to think that a count of under 30 million is low.
Yeah. Even though some of them has 80, 90 million, they're infertile.
Right.
They are not able to, because sperm has some of them 80, 90 million sperm people has a high DNA fragmentation test. Then what?
Right.
You can't. And some of the smokers, drunkards, they have got high count, but they're not able to, those pumps are useless.
Mm-hmm.
Yeah,
okay.
It doesn't mean that, sometimes the man comes and tells that, hey man, I got a lot of sperms. I don't have any problem. No, you have got. So that's the time we start screening them.
Okay.
Yeah.
Wow, that's really helpful. So motility and mobility, are those the same thing?
No, mobility and motility is it's the same thing. Same thing.
Okay. Okay. Sometimes you see that, so I wasn't sure.
Yeah.
So that's good to clarify those things, just because I know sometimes you get a report back, not necessarily from, you may have an initial appointment with a urologist and you get this report back and you see motility and mobility on it. And to the layman's eyes, what does that even mean?
Yeah.
So thank you for clarifying those things.
Yeah. These days is technologies and depends on the center. Whichever patient wants to go for any kind of fertility treatment or IVF, CIAW, anything, they should make sure that that center is the right center they're ending up. Even you give me 5 sperm or 10 sperm, I'll do the ICSI. So it's a different. Different embryologists do the different work. Everybody do the good work. Okay, yes. It's all expertise. I'm in this field past 30 years. So I've seen the very poor motility, poor sperm, poor egg quality. We have got the expertise to do all these kind of poor cases. We have done so far a lot of cases, a lot of success rate, which is some places they're not able to create the embryos. We done the very good create embryos. We got high rate of the blastocyst rate, and we got PGTA, even though creating the embryos, after that you wanted to have the normal or abnormal to check the embryos, like a blastocyst, we have got PGTA program. So we do the PGTA, we do the biopsy lot, and we got all sort of technology.
Yeah, it's amazing. Well, I don't see any more questions. No one. I just have one comment actually from someone who's watching over on Facebook. I just want to say this education session is the best and most educational. Thank you so much. I wish the clinic I was seeking would have only gone through all of this. And that's a great point. And that's exactly why Fertility Matters Canada brings together experts in the fertility industry to you virtually, weekly. Right now we're in Canadian Infertility Awareness Week, so we're doing all kinds this week. But, sometimes in an appointment with a physician or a fertility specialist, it doesn't mean that the information wasn't presented, or maybe it's just, there's a lot coming at you and a lot of it is brand new information. So we know that the more we can help educate patients with experts like Dr. Munaf and all of the other experts that we've been working with, you'll feel more empowered to take control of your reproductive health when you're sitting and having conversations with your physician. After this conversation with Dr. Munaf especially, you'll say, gosh, I know what motility and mobility are, and maybe the cutoff for low sperm count. That makes you feel better and more in control of a conversation to get the maximum benefit out of your time with your physician.
I have one good point here, what they did it. See, most of the couples, what they do, oh, we got infertility, they go to the Google and Google it. Google, yes. Some extent is good, some extent is not good. Because some information, it is not for you. You have got right information, maybe, it is not for you. Like, you know, some of the symptoms, people like a cardiac patient, they go to the Google and see this kind of symptoms you have got. It's a wrongly. Sometimes, you know, psychosomatic, mind-body medicine. You know, you induce your symptoms on your body unnecessarily. It is not for you. It is not. It's a, who creates? Google creates. When you're reading, you are stimulating yourself. You are picturizing yourself, right? That is the time it's a wrongly. Yeah. That's a wrong influence. So you got any questions, please go and see expertise. Talk
Absolutely.
To them.
That's right.
See, I'm in this field for a long time. We do a lot of research. We connected with all over the world. So we know exactly, if we don't know, we have people to know where to find the information.
Agreed. And if you're not sure where to find the information, or you're not sure where to find an expert in your area where you're living, your geographical area, please reach out to Fertility Matters. We will do our best to line you up with the specialists that you need to be lined up with. So that's what we do. We are a free service. As a charity, that's the work that we do for patients. And we connect you with experts like Dr. Munaf and the team at Anova.
Thank you very much.
All kinds of other clinics across this country to make sure you get the most out of your fertility care.
Absolutely.
Dr. Munaf,
yeah, go ahead.
Do you have any last words?
Last word is like whichever maybe your unit you're going for treatment or anywhere else, make sure that it's the right clinic for you. Take the review. Go and sometimes review says something and that center says something. And sometimes review says bad, center is very good. Go and see them, visit them. Visit them. Tell them, I just want to see you. See our center, come and see me, talk to me. When I'm giving you any kind of knowledge, I'll talk with the reference. If it's not my work, I'll give you my reference. If my work, I'll wait until publish my paper. That's been peer reviewed, all of that.
That's awesome. That's great. So that's great advice.
Always make sure that who's you're talking. Go and talk to them. Go and talk to your lab director. Go and talk to the embryologist. Just see that how they are good, what they're saying. Educate yourself. Don't jump into the treatment immediately. Oh, this unit is good. No, go and talk to them, how they are. That's most important to find out the right clinic for you. That's the message for everybody.
That's great. That is great advice. Thank you so much, Dr. Munaf, for being here. It was a pleasure to meet you officially online, virtually like this. Thank you, Anova Fertility, for helping to put this event on. Thank you for your continued sponsorship of our organization, and in turn, these events that we're able to bring to all Canadians who are struggling to build their families. It is Canadian Infertility Awareness Week 2020. We are wrapping up things tomorrow, so please make sure if you've missed any sessions, go back to our Facebook page. All of the listings and events and videos are living there, and they will be live on our YouTube channel later next week. Thank you so much, everybody, for tuning in, and we'll be back later this afternoon. We've got 2 more sessions.
Thank you. Thank you very much.
Have a great weekend.
Thank you very much for having me. Thank you.
Bye.
Bye-bye.